Human body need healthy fat for vitamin D, vitamin B12, for the vitamin A, E, K. So they need animal fat. And human body needs vegan fat too. But animal fat needs less, but make sure the digestive tract should be good.
Well, I'm Dr. Noel Boaz. I'm an MD, PhD, and I specialize in human clinical anatomy and evolutionary medicine. I'm very pleased today to have a discussion with Dr. Haque about his approach to dealing with integrative medicine and dealing with the whole patient. We have a few topics today that I think quite timely in looking at issues that patients around the country and in fact around the world are dealing with.
Correct.
Dr. Haque, it's a pleasure to be with you today.
It's so wonderful, Dr. Boaz, meeting virtually, and we're going to discuss such important topics. And it's so happy and it's a pleasure to speak with you today.
It's a pleasure to be here. Now, I have a number of topics that you've sort of indicated are of great interest to your patients, and then we sort of I had a question. When you have a lot of young people, and in fact, it's been around for a while, are very interested in trying to find follow a vegan diet or a vegetarian diet. What do you tell them about that approach?
Vegan diet, I don't recommend for a long time. And you know that the founder of American Vegan Society, Mr. J. Dinsha, he died out of heart attack in his
Mm.
office. All of a sudden, he never tried cheeseburger, he never tried hamburger, always vegan. So that's wrong. So human being need everything. They need, God created the world, he gave us the food, and he gave whatever we need. So that's a faith perspective. But science-wise, human body need healthy fat for vitamin D, vitamin B12, for the vitamin A, E, K. So they need animal fat. And human body needs vegan fat too. But animal fat needs less, but make sure the digestive tract should be good. So in terms of vegan diet, some patient we need to give vegan diet temporarily. For instance, someone is a terminal cancer patient. So, we can give them supplemental vitamin B12, D2, and K3, but they need to have a vegan diet because their gut is messed up. Someone have a serious autoimmune disease or more than one autoimmune disease. For them, they need to be very alkaline diet. So animal products are acidic. So they need to be vegan diet, raw and cooked, both combination, so that long run their body go back to normal, a good pH in terms of stomach, skin, stomach, tissue, and blood. So vegan diet is important temporarily. Long run vegan diet is dangerous because your cell will be struggling to regenerate without B12 and D3.
Mm-hmm.
Even DHA, even DHEA. So a lot of important body essential nutrients are in the animal fat. So vegan diet is good for temporarily, very healing, very calming, but not for long run. Especially for someone have a serious digestive tract, for them vegan diet works as well for short term.
That's very interesting, and I was also interested to hear your point because we as physicians must ultimately realize that we're treating individuals, and
Right.
an individual focus I think is also quite important with diet. For example, we know that some people from some populations don't digest lactose very well. That's another thing that we, from a sort of evolutionary biological standpoint, are aware of. And I think that having a focus on the patient and knowing their history or in their populational affinities can also tie into what sort of diet might be optimal for a particular patient.
Yeah, I like that you thought. Yeah, of course. It should be always patient oriented, not that protocol for general everyone.